Usually, swelling in my clinic, if it happens, subsides by 5 to 7 days after the procedure. Only rarely, once or twice in a year, do I come across a patient who reports swelling which has descended down into his eyes and persists. But with proper surgical care and patient follow-up, it is not a big issue. If the clinic case after case reports swelling in all patients, there is something wrong with the technique. They should go through their protocols once more, see where the trauma is coming from. Or is the patient following up the aftercare that has been given to him or not? Now, how does a surgeon prevent swelling from happening? Number 1, giving preoperative medications that prevent swelling, avoiding aspirin and ibuprofen before the procedure, doing proper lab investigations to rule out underlying disorders like diabetes and a host of others, minimally invasive procedure, causing less trauma using minimally invasive technique, using triamcinolone acetonide or Kinocort during the procedure, using proper post-operative instructions, anti-inflammatory drugs to facilitate healing. On the other hand, how does a patient prevent swelling? Number 1, avoiding exercise in the first 1 week after the procedure, not talking animatedly, not bending forwards in the first 3 days, taking it easy, trying not to work on his PC, on his laptop, which requires him to be bending forwards. But if swelling has occurred, a gentle forehead massage in the direction of the temples without upsetting the grafts, starting from the center going outwards, will to a great extent allay the problem. And if you're traveling from out of town, it is always better to stay at a hotel rather than relatives whom you've met after a long time. Because in a hotel you are not bound socially to engage in polite conversation. Elevation 45 degrees to 60 degrees on the first night of the procedure. And after the first night, sleeping with your head up using 2 pillows so that the head is elevated, so that with gravity, swelling, if it happens, is drained more effectively. Elevation helps by decreasing the venous and lymphatic pressure. This makes the swelling flow along lymphatic channels in the temporoparietal scalp or backwards, preventing facial swelling. Then activities of daily living like eating, going to the bathroom, tying shoelaces are no problem at all because edema fluid moves very slowly. It takes at least 1 or 2 days for lymphatic fluid to move from below the hairline to center of the forehead. But always be vigilant, always be careful. Once edema has begun, steroid, ice packs and other physical methods have little or no effect at all. Therefore, prevention is the best treatment. If you have any questions, leave a comment in the comment section below.